Well, this is the day we elect a new chair, so I figured everybody's going to be here because, whoever's not here is the one that gets to be the next chair, right?
Exactly, except it's not on the agenda. Oh, I guess it is. Shoot.
I have to start our day off with a little humor. One, two, three, 4, 5, 6. Well, I see that we have a quorum. I don't think everybody's here yet.
Got 10, it looks like.
Yeah. Trying to think of who we're missing.
Okay, Josh, that's a new look for you. Man.
Missing. Oh, there's Brian. Okay, good. Now Mr. Hafner said he wasn't going to make it. All right, well, we're close enough. So welcome, everybody. I should ask first Ann. Ann, are you ready for me to call the meeting to order? Or?
We are ready.
All right. Always have to check with Ann to make sure I don't get myself in trouble. All right, we'll go ahead and call the meeting order. Thank you, everybody, for coming for the December Board of Health for the Spokane Regional Health District Board meeting today, held via Zoom, or actually GoToMeeting, sorry. And we'll go ahead and call the meeting to order. So, Ann, would you mind doing a roll, please?
Commissioner Al French.
Here.
Commissioner Josh Kearns.
Here.
Commissioner Mary Cooney. Here. Council President Brian Beggs.
Here.
Councilmember Karen Stratton.
Here.
Councilmember Betsy Wilkerson.
Here.
Councilmember Linda Thompson.
Here.
Mayor Kevin Freeman.
Here.
Board Member Andrea Frostad.
Here.
Board Member Jason Kenley.
Here.
And Mayor, we know that you're here. The only absent member is Board Member Chuck Hafner.
And he had a conflict today, so apologize that he isn't able to join us today. Kind of moving on for Chair's report, just as a reminder, we have switched to Adobe Sign for our signatures for board materials. And I didn't see it at first, so just as a reminder, it looks like it comes from Ann, but it's actually coming from ecosign.com, which is the email address that Adobe uses. So if you see that caught in your spam folder or not recognizing that, it's actually the board packet materials. So just kind of be on the lookout for that. As well as we had the approved conflict of interest policy. And we need to get the signatures back from each of the board members for the acknowledging the conflict of interest policy as well. So if you haven't had a chance to do that, please get with Ann to get the form if you're missing that, but we need to get that turned in as well. And that's all I really had for a Chair's report. So we'll go ahead and move to consent agenda. Is there anything on the consent agenda anybody wishes to consider separately today? Seeing none, do I have a motion to approve the consent agenda?
This is Linda Thompson. I move to approve the consent agenda.
Betsy Wilkerson, second.
Perfect. Moved and seconded. All those in favor, please signify by saying aye.
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 All those opposed, nay. Hearing no nays, motion is approved unanimously. Thank you, everybody. And with that on our agenda, we have an executive session to review the qualifications of an applicant for public employment pursuant to the RCWs and litigation/potential litigation pursuant to the other RCWs. Are we thinking, Michelle, 15 minutes, 30 minutes?
I think that 15 minutes would be a good start because we may not need the potential litigation segment of that. So.
Okay. So with that, I guess we will adjourn into executive session for 15 minutes at 12:35. And all the board members should have had another link to go to the other meeting.
The Board of Health Chair has requested an extension of the executive session for an additional 15 minutes. The Board of Health Chair has requested an extension of the executive session for an additional 5 minutes.
I know we're still missing two. What time did you extend to last?
We have 1 minute before we can go back into session.
That's okay. District Interim Health Officer. Do we have a motion today?
So moved.
This is Linda Thompson. I'll second.
Okay, so the motion that I understand from Karen is to appoint Dr. Velasquez as interim health officer until the replacement's found. Is that as I understand your motion? Karen? Yep. All right. Any discussion on the motion? Seeing none, that means we're all ready for the question then. All those in favor, please signify by saying aye.
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 All those opposed, nay. Hearing no nays, motion is approved unanimously. Congratulations, Dr. Velasquez, and welcome to the group.
Thank you.
And we'll move on to Resolution 20-15, authorizing a 2020 general fund budget amendment.
This resolution is our expenditure authority. This tends to happen around this time of year where we need to update the expenditure authority to finish out the year and then get us to 2021 with our new budget authority or expenditure authority.
Okay, do we have a motion?
Move approval of resolution 2015 as presented.
Thank you, Mayor Freeman. We have a second.
Second.
Thank you, Dr. Kinley. Any discussion? Seeing none, all those in favor, please signify by saying aye. Aye.
Aye.
Aye.
All those opposed, nay. Hearing none, motion is approved unanimously. Thank you. Next, we'll go to Resolution 20-16, adopting a Board of Health legislative agenda for the 2021 State of Washington legislative session.
Yes, this is the resolution that would bring approval for the legislative priorities for 2020 and 2021. The policy committee, this came to the board as a draft last meeting, and we sent it back out to committee members and did receive response with updates. So attached is based on those updates and edits.
Okay. Council President Beggs, anything you want to add as the chair of the policy committee?
Yeah, just I thought, one, we had really good discussions in the policy committee about this. And then secondly, we continue to wrestle a little bit with the same thing the general public might be, is that we're trying to speak in generalities as opposed to endorsing or opposing any particular bills. But we're trying to prioritize what we want the legislature to focus on. So I thought the process worked really well, and I strongly endorse it myself, and the committee did as well. So.
All right. Do we have a motion to approve then?
So moved.
Great. So move from,
Second by Linda Thompson.
right? So Councilmember Wilkerson for the motion and second by Thompson. Any further discussion?
I have a question. This is Andrea. Is this for actually approving, or we're just approving the draft? Are we actually approving this now?
The motion is to actually approve it today.
Okay.
Do you have a question then?
So this is what this is from the community and for the policy committee that had met. The policy committee met and went over this, and then this was presented to us.
It was presented to us as a draft last month, and now for.
Well, I don't remember seeing it in this form last month. It seemed very, so I must have missed that.
I'm not sure. I know the policy committee met multiple times, I'm pretty sure, on it. Council President Beggs, do you have any?
I don't know. I'm trying to go back to my memory. I don't know that we presented this draft to the full board before. It came to executive committee a couple weeks ago, and we sent it back to the policy committee to see if anyone had any further comments. So my recollection, but I could totally be missing a step, is that policy committee debated it. Then we got a draft. We made some more suggestions. Those were implemented. It came to executive committee for an initial look at, and then we sent it back to policy one more time to see if there were any other changes. So I think this might be the the first time the full board is seeing this, but it has gone fully through the policy meetings that were well attended. So.
Okay, so as you said, Brianne, there is a lot of generalities to these priorities, and I was trying to see how this applies to Spokane locally. And just for an example is, just pointing out one is school-based health centers, versus, are we asking for this in our community? Is this a need in our community, or versus nurses? Because the benefits are sort of the same, and we have, I'm just trying to look at this from that perspective, on what's specific to our community.
So this document is for our staff to talk with legislators about what's important statewide coming from our community, but it's not the agenda for our community. And I realize that's kind of nuanced. So this document doesn't mean we go to the various school districts and say, we want you to do this or that. It's more for going to the legislature and saying, hey, we're one health district and we would like you to explore these issues and take up these issues. But it's not saying that we as a health district are telling every school district how they should do it or not do it. I'm not sure if that answers your question, but.
Yes, it does. I'd like to go back to, I guess there's just some specifics in there that, I understand so that it's more open so they can discuss what would be appropriate for a local avenue.
And I know, Amelia, you had your hand up. Did you want to add that before you switch to another topic?
Well, I was just going to clarify that this was in the October 29th meeting. I just pulled the minutes and everything back up. So I just wanted to clarify, it did come to the full board and then it went back to the policy committee. I was just offering clarification.
Okay. All right.
Go ahead, Andrea. Did you have another question before we go to the next one? All right. Councilmember Thompson.
I just wanted to say that this is, it's priorities. And so there might not be specific bills linked with these, but as we look at ways to increase equity and inclusion, and we look at ways to support treatment and prevention and recovery, as we're seeing mental health needs rise, that our legislative liaison and we as board members will be looking at how policies are moving through the state legislature. And this is just a guide for us to look at what our priorities are, like public health infrastructure, to make sure that we're doing everything we can to have foundational public health services for our community. So we haven't gone over everything and looked at bills that might fall into this, but these are our priorities to look at these sections of legislation that might be coming out. And so I'm very much supportive of this as we continue to look at how our community and is affected by the health needs and the growing need for mental health parity with medical health. And I just think that this is a way for us to have a guide to look at legislation that may be coming out as we meet with our legislative folks and teams. That's why I'm very supportive of it.
All right. Thank you. Any other questions or discussion today?
This is Commissioner Kearns. I just wanted to also highlight one of the reasons why specific bills are not referenced is because this is the first year of a biennium, and at this point, the vast majority of bills have not been introduced yet. Bills can be pre-filed at this point. I think that started on December 1st. But where you're really going to see the volume of bills pick up is when we get to that first day of session, and even a week into the legislative session, as members are allowed to get co-sponsors for their bills and drop those blue sheets and pink sheets. So at this point, that's why it would be it would be a little too early to be singling out specific pieces of legislation because the vast majority of the bills have not actually been introduced yet for the biennium.
Michelle, would you mind reminding us just of our role with lobbying? I know there's some certain restrictions as a board that we're allowed to do or not do.
Yeah, generally, this board is fairly restricted on any direct lobbying. And part of the reason for that is that this is not an elected board. You're not elected directly to the health district board. And so you're not as accountable as you would be if you were part of a board that's directly elected. And what we do is we can work, you each can work through your own jurisdictions because you are elected to those boards. And we also have public health lobbyists that we work through to establish what our priorities are. But I'm glad you asked that question because we don't directly lobby as the health district.
Thank you. Any other questions or comments tonight? Seeing none, that means we're all ready for the question then. The motion on the table is to adopt the Board of Health legislative agenda as presented for the 2021 State of Washington legislative session. All those in favor, please signify by saying aye.
Aye.
All those opposed, nay. Hearing no nays, resolution is approved unanimously. Thank you, everybody. Next, we have Resolution 20-17, which is the approval to sign a MOA covering the 2021 and 2022 COLA and 2021 benefits for employees of the Spokane Regional Health District who are members of the Professional and Technical Employees Local 17.
Yes. So this resolution is the tentative agreement between the Protect 17 group and the health district. The negotiations just wrapped up, I believe, last week, and this is the result of those. So looking for approval.
All right. Hopefully members have had time to review that. Do we have a motion today? Commissioner Cooney, you're unmuted.
So moved. Second by Linda Thompson.
Appreciate it. Any further discussion? Seeing none. All those in favor, please signify by saying aye.
Aye.
All those opposed, nay. Motion is approved unanimously. Next, we'll go to Resolution 20-18, approval to provide matching benefits to all Spokane Regional Health District non-union employees as provided to members of the Protect 17, covering 2021 and 2022 COLA and 2021 benefits. Ms. Clark.
Yeah, so similar to my last comments, this is just to maintain internal equity and provide that same benefit to the non-represented through Protect or WSNA benefit.
Okay. Do we have a motion?
I move to, go ahead.
I was going to so moved again. So
Moved by Commissioner Cooney and second by Commissioner Johnson. Any other discussion today? Seeing none, all those in favor, please signify by saying aye. Aye.
Aye.
All those opposed, nay. Motion is approved unanimously. Next, we have Resolution 20-19, which is adoption of a labor contract for employees of the Spokane Regional Health District who are members of the WSNA union for the period of October 1st, 2020 through September 30th, 2022. Ms. Clark.
Yes, so similar to my two previous comments, this is the tentative agreement between the nurses union, WSNA, and the health district.
Okay.
Linda Thompson, move to adopt Resolution 2019.
All right. Do we have a second?
I'll second.
Seconded by Commissioner Cooney. All right. Any further discussion today? or questions? Seeing none, all those in favor, please signify by saying aye.
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 All those opposed, nay. Hearing none, motion is approved unanimously. Next, we have the election of the 2021 chair. I know typically we have a tradition of the vice chair stepping up to the chair role, but it is open for nominations or a motion to approve a new chair. I don't know, Commissioner Cooney, are you willing to step up for the chair role next year as the vice chair this year?
As the vice chair, yes, I'm willing to step up to becoming the chair.
All right.
I will nominate Commissioner Mary Cuney to be chair of the Spokane Regional Health District Board of Directors for the year 2021.
I'll second that.
Yeah.
All right. Any other interested parties or nominations for chair for next year? Seeing none. All right. All those in favor of having Commissioner Cooney be the 2021 chair of the Regional Health District, please signify by saying aye.
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 All those opposed, nay. Congratulations, Commissioner Cooney. Yeah. Now, similarly, for an election of a new vice chair for the year 2021.
So I move to appoint Mayor Kevin Freeman from the small cities. We've kind of done a rotation, and so Kevin, seeing if you would be the vice chair, because I believe before Ben it was Brian from the city of Spokane, and then Spokane Valley County Commissioner, and so now the rotation would just go to the small cities if Mayor Freeman is willing to take the nomination.
I will.
I'll second the nomination.
All right.
Thompson.
Johnson. Any other nominations or interested parties? Don't everybody jump at the same time here now. I know, right? Okay, all those in favor of Mayor Freeman for the vice chair for the 2021 Board of Health District, please signify by saying aye.
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 All those opposed, nay. All right, congratulations, Mayor Freeman. And then it takes us, as we complete our action items, into reports. So, report of the administrative officer.
Thank you. So have some stuff to report out on this week. One thing that you may have read in the paper, but you'll be hearing more about it from the health district, is that on November 21st, the state launched what is called the MED project, the Medication, Education, and Disposal Project, because we need another acronym, but MED project launched, and it's a way for Washington State residents to dispose of expired, unwanted, or unused medications safely and conveniently. And here at the Health District, we have agreed to be a drop-off site for those medications. So, for example, if someone is cleaning out their medicine cabinet, maybe they had surgery and have pain medicine in there that they need to dispose of, we will have bins here at the Health District to safely dispose of those. So more information is going to be coming out about that, and treatment services, because they're on the first floor, are going to kind of take the lead on that. So if community members are coming in, they don't have far to go. They can just go right there to the first floor to do that. One thing that I'm obviously working on right now is recruitment for a permanent health officer. And just to kind of go through what the timeline looks like for that, we actually yesterday posted the RFP to the Health District website, and also sent that to the newspapers for the RFP to be promoted. And we're doing it as a nationwide search. So we included newspapers throughout the U.S. in major cities with major distribution. On the 14th of this month, questions on the RFP are due back to the health district. The 16th responses are issued. On the 18th, the proposal submission deadline occurs. And then on the 21st, we would be able to review those. Pending the board calendar and what I would bring forth in January, we could award the contract, obviously looking to the board for approval of that contract. I will also take to the executive committee in January a plan for what that recruitment looks like, including what the recruitment committee would be, including board membership. So I will be looking to board members who are interested in participating in interviews and in review of applicants. So that's what you can plan for in January. Questions on that before I move into program impacts?
Questions on? Okay, good.
Okay. So at the executive committee, and I was unable to be at the executive committee, but it was my understanding that there was a request for me to report out on program impacts related to budget changes. And so I've got a summary here that I can go through. So we had 5 regular positions and 1 project position that were eliminated within the budget. The positions that were laid off all could use the comparable vacancy process to apply for other positions at the health district, like the COVID response positions. And I know that those staff many of them are taking advantage of that opportunity. Regarding specific programs, Neighborhoods Matter, what we have done there is we have consolidated from 4 positions in that program down to 2 positions. And the focus of those 2 positions will be to maintain the work that we have done on community engagement and prevention of child abuse and neglect. We were unable to retain all 4 of those positions due to the large need for local funding or another funding source to keep them going with the 4 staff. However, I think that this allows us to kind of, focus in on those specific and individual neighborhoods and look at system and environmental changes to maximize the reach of our local funding. So to really take the local funding we have and focus it. Walk, bike, bus, and safe routes to school is potentially impacted. I'm going to save reporting out on that until I have a chance to talk to the manager over that program, because I received some additional information about funding this morning. So I need a little bit of time to get that back to all of you. Active living, that is one of the issues or one of the programs that we did not have enough funding for this year. We have not had anybody in the active falls position since May. And with the position being inactive for over 6 months, when we looked at where we need to realign programs, that was a program decision that we decided to make. The opioid task force and suicide task force. The opioid task force program has been taken on by the treatment services division here at the health district. Treatment services, along with the minimal grant funding that is received for that program, generates enough revenue that we can actually cover the cost associated with the program. So by putting it within that division, it seemed, like a way to keep the work going, but also to reduce the financial impact to the agency. Regarding the suicide task force, there was no additional funding available to support that work. SRHD has jointly convened this group with the Fail Safe for Life program, And we are in the process of working with Sabrina Votava over there to create a transition plan with our current members of the suicide task force and identify a way for SRHD to still participate as a member of the task force. So the work is not going away. One project that I think there's been some confusion about, and I know there's been some public confusion about, is the African American Health Project. That project was funded to begin January 1st, 2019 and end December 31st, 2020. It was only funded for a 2-year project. So the position that was eliminated through that is because the project ended and the funding ended. And so it technically wasn't a budget impact, but I wanted to make sure that you all knew what was happening there to make sure we're really transparent about the process. I think that that's one of those that, given our resolution to equity, that if funding becomes available, it is definitely something that we need to revisit and should consider.
I see Councilmember Wilkerson, you had your hand up.
Thank you. So that just leads me into Neighborhood Matters. What efforts are being put forth to incorporate that work so it doesn't just stop? If we've invested 2 years into that and then it ends, where does that go, Amelia? Or who picks up that work? Or what's the continuation of the work and that investment?
That's a really great question. I think that what we've tried to do with the Neighborhoods Matter staff is keep 2 of the positions there that have been there for a long time to keep some of that consistency. I think that the relationships are still there in the community, so that we can keep moving forward. I think that given the focus on child abuse, neglect, and the prevention of those, that's a lot of what the Neighborhoods Matter group is looking at. Unfortunately, when the African American Health Project started, that started before my time. So I'm not really sure what the full the scope of the program, like what if there was a plan to continue it past this year. That's not something that I could find.
I'll just connect with you offline because that's really, I think that's important to the whole neighborhood, especially in COVID times. We talked a lot about targeted investment in neighborhoods. We all know that's one that's been sorely disinvested in. And I would hate to see our leadership and commitment to equity get lost just around dollars, because all across the board, people still matter, no matter what their color is. So please connect with me later because I want to hear more about that. And what was the research they found? Because I like that to be shared with the community also.
And we are still doing the care coordination related to the pandemic in all the communities, but absolutely we'll connect with you following the meeting.
Councilmember Thompson, you had your hand up.
Yeah, I was going to ask at the end, but I'm glad that Councilwoman Wilkerson stepped in there. Are there active Neighborhoods Matter projects going on right now? And which neighborhoods are they in?
Yes, and I could send that out to all of you. I don't have it right here. I kind of just summarized it all down for my report, but I could send it out to you.
Okay, because I think that would be a way to integrate that African American health work if in the neighborhoods that we do have Neighborhoods Matter going, and that maybe we can find a way to outreach to other neighborhoods in more of an overall arching effort to keep that going somehow.
Yep.
Okay, go ahead, Amelia.
That actually, I know Lindy is on here and is going to talk about the COVID-19 response, so I will segue over to her.
Any questions for Amelia or further questions before you go over to Linda? Seeing none, all right. Thank you, Amelia. Linda, COVID-19 response, the topic of the day.
Yes, for the year. Good afternoon. Trying to boil it down to maybe 10 minutes, but if I go over, I will, just try to keep it short. So in general, we are averaging about 350 cases each day. As everybody knows, we are on an upswing. Most of the cases are in the 20 to 60-year-old groups. The older age groups and the very young are considered stable. They aren't higher than they've been over the last month or so. As of this time, there are no racial groups that are showing higher cases than other groups, which is good because we have had some groups in the past that were not in line with the population in the community. So safety, we are continuing client temperature checks and as they are coming into our building. We do weekly risk assessments and they are continuing at our facility in my place. And the city actually is helping us do the safety checks at the Immaculate Heart Retreat Center. And we have not had any safety concerns at this time in those places. We are providing some behavioral health training opportunities to staff. We have a lot of staff that are very fatigued and exhausted, and it's just really wearing on people. So we are really trying to bring in some trainings and help them out. We are working with the shelters on increasing their hand washing, some spacing concerns, and adherence to masking. In the area of communications, lots of great work going on here. Hopefully you've seen a lot of the Department of Health ads in the media. We are getting a lot of requests right now to get information out on the WA Notify app. And we do have information on our website about that app. The disappointing part of this app is it does take a lot of our staff time to fully implement it. And that was not clear up front by the state that we would have to put staff time into it. So we're trying to figure that out and how we make that as smooth as possible, but we have to link the positive cases so that they can then send out through the app the exposures and notify them. So it's not as quick and easy as they made it seem. So lots of questions about that from media, and communications is doing a great job in getting information out about that. They're also responding to questions on testing efforts, vaccine safety and distribution, and mental health resources that are available to people. In the area of equity, the Equity Task Force does meet again today. Their topic is on behavioral health needs, and Better Health Together will be on there as a presenter talking about their mental health first aid training that they are providing in the community in January to agencies. And so we do hope to train some of our staff on that type of information. Members in the task force have identified some certain groups about vaccine hesitancy. So we're going to do some outreach there and find out what groups are having that feeling and why they feel that way. And then hopefully we can respond with some good information on vaccine safety and help them not feel hesitant to get the vaccine. Helene is putting together a Latinx team, and we've been doing these little outreach teams in different areas when we see a need, and so they are seeing that we're needing some outreach to the Latinx community. In the area of finances, as many of you know, we do have concerns about funding past the end of the year, and doing some work around estimating the cost of what our current contracts and our staffing cost, and then what it takes to continue this work over the end of the year into the end of this pandemic, hopefully. Logistics. Providence has agreed to keep the 40 hospital beds that we had out at the fairgrounds, so we do have access to those ongoing. And then we had 3,000 care kits delivered today. They are now in our basement, and they go out to our community partners to get distributed to families at home. Care kits have thermometers, masks, hand sanitizer, soap, and different hygiene products to keep people safely at home. Operations. Surveillance continues. We are going to update our dashboard on the website daily, 7 days a week, while we're having this huge surge because there are so many questions about numbers. And outbreaks just continue in every sector across the country and community. So there's, again, no one sector that stands out. It's really occurring everywhere. We do have 15 new outbreaks in long-term care and congregate living facilities. And so that is the area that's probably the greatest of concern to us because of those high-risk individuals living there. Case investigations and contact tracing. We have about 40 disease investigators through our Public Health Institute and our own staff. And we're, again, hoping to continue that contract over the next year. We also have about 15 additional staff that are doing this work in-house. We are meeting daily with many of the systems, such as the shelter system, the jail system, and we continue to work on helping them mitigate and control outbreaks. We are identifying a process right now for testing in the jail system upon intake and during the time of quarantine before an inmate goes into the regular living situation. We are trying to figure out with the medical services at the jail system how to provide surveillance testing along with outbreak testing, working with a federal service and our federal dollars and just how that works together. So we are working on that and we can talk to you more about that. There is some updated CDC guidance on quarantining and we'll have to reconcile our guidance that we have with the Department of Health, the CDC, and our own materials and then get that out. There is the thought that 14 days is very long and it reduces adherence to quarantining. And so this new guidance will shorten that a little bit along with some criteria on who can do that and who can't. We continue working with childcare, school districts, and universities, trying to support them to keep open and hold regular calls with those sectors. Care coordination continues. They are feeling very overwhelmed right now. They are supporting about 200 homes, trying to keep people isolated or quarantined at home so they don't go out in the community. We are transitioning to Better Health Together, who received a grant from the Department of Health to do coordination in the 5-county region. And so we're working over the next month to make that happen. Healthcare system, we continue to monitor the capacity through the Ready Healthcare Coalition and continue to see the primary stress for them through staffing shortages and discharge challenges. So we are holding meetings with them regularly, including their leadership on how to manage that work. Our isolation facilities, currently we have about 40 clients in the facilities, and that's between my place and the Immaculate Heart Retreat Center. We are working with the STA and the Guardians now on providing vans and drivers so we can move people from the shelter to the isolation facilities 7 days a week throughout the day. If you remember, we have a contract with MedStar, but they're only able to do it for about 3 hours a day, and we need it much broader than just that. The city also helped us identify a staff person to take on the role of transportation coordinator between all of these different facilities. So the shelters, isolation, quarantine, and just what is the best transportation for each of those individuals. So we're excited about that and appreciate the city really stepping in and helping with that. Community testing, lots of questions on community testing. Our mobile testing continues at the shelters to really help mitigate exposures. We are using our HIV medical case management staff right now. They've been trained on testing, and so they have been able to help step in and increase the testing in the shelters. We have provided about 1,800 test kits to community partners in the congregate settings to help them with their outbreaks and managing those situations. We are supporting Chaz, who has been a great partner around community testing, and they are opening some testing at the arena starting December 6th. We have supplied them with some test kits and really helping connect them with other community partners that can give them volunteers or support in putting on the testing 7 days a week. And then if you ever want to know all the testing resources that are out there, it is posted to our website. Vaccine planning continues. We are really following the Department of Health planning guidance for vaccine distribution, and staff meet regularly on calls with the state and locally. They have created a vaccine newsletter and just trying to keep everybody apprised of the planning and what the situation is. The latest information that we have is that Pfizer vaccine has been approved, and we will have about 62,000 doses by next week in an initial shipment, and then about 200,000 additional by the end of the year. And the priority groups for this vaccine is healthcare providers and our long-term care settings with our vulnerable population. Then just a couple more areas. Our business technical advisors are also being very overwhelmed. Whenever there is a change in guidance, it impacts all of those sectors and how we have to get information out and changes in that guidance. They have helped over 3,500 different businesses with requests for assistance. They are really asking businesses to be proactive around implementation of guidance. And so they're really increasing the guidance that is on the website and pointing people there to look at. And then last but not least is mass fatality. And we continue to monitor the fatality capacity between our hospitals and our ME's office. At this time, they are not overwhelmed, and we're hoping, of course, that it stays that way. So any questions?
Go ahead, Council President Beggs, then Dr. Kinley.
Yeah, thanks so much, Linda. It's very helpful information. I was just wondering, I'm not sure if it's you or Dr. Velasquez, but my understanding is there's a bit of an outbreak at the downtown jail. I'm just wondering the extent and how that's impacting and what we're doing about that.
Yeah, so the staff tell me that they have been in daily contact with the jail system. Staff have brought it in from home, and I believe there's like 6 or 7 staff, and then there are some inmates. So they actually have a call right now, and they're talking to the jail setting on how to continue some antigen surveillance testing, as well as PCR testing to upon intake when somebody comes into the jail system, so they can really identify positives and then put them in a isolation or quarantine setting. So I think we're on it, but definitely there's an outbreak going on.
Dr. Velasquez, do you want to add anything there?
No, I think Linda summarized that really well. It's a very comprehensive effort from the team here and the team there, because we're not just looking at the outbreak today right now, but how do we move forward with some surveillance and prevention, and we'll talk about that some more in the future. Thank you.
Thank you, sir. Dr. Kinley.
A couple of questions. First, the numbers you gave for the vaccines, are those for Spokane or all of Washington State?
All of Washington State.
Okay, so do they know how that's going to be distributed between East and West, and how many Spokane's actually expected to get?
I haven't heard the number for Spokane yet. I do understand there's about 500,000 healthcare workers, so that 200,062 is not going to go very far. But it's probably based on licensed healthcare providers.
Okay. The second question I've got is that in the UK right now, the government is actually requesting that vitamin D be distributed to the elderly and those at high risk because there's so much research suggesting that low vitamin D levels are associated with an increased risk of mortality and serious cases. Has there been any discussion about potential distribution from the Washington state government to these long-term care facilities using the research that other places are currently looking at?
Yeah, I know our epi staff stay on top of research all the time. I haven't heard about the vitamin D one. I don't know if Dr. Blasquez wants to speak on that. It's something I can check into.
Okay, thank you.
I can mention that there is some research on vitamin D on this particular subject, but we don't have guidance from the state in that regard, although there is literature, particularly coming in the British Medical Journal. So we'll be from that.
Thank you. Are we looking at potentially trying to get that to long-term care to see if they want to add that? I mean, we're concerned about these long-term care facilities. We have a lot of data. There's no guidance because this is all new territory, because this is a new problem within the last 12 months. And so this data, as you know, is always changing. I'm just looking at it from the standpoint, if we have data to back this up, I feel like we should be trying to get it out there to give them an option, whether or not they use it, but at least so that they have the information, because it's just hard to stay on top of.
Right. Yeah, it's definitely something I can check into.
Councilmember Wilkerson.
I was just going to add, I have a long-term care facility and we have gotten no guidance around that at all. There's been no data, no information in any shape, form, or fashion. So.
I'd say it's a coming attraction. All right. Any other questions for Lindia? Oh, Councilmember Thompson.
I just want to say that I know that the staff is working incredibly hard. And is there anything that we could do? And I'm just asking if, me personally, is there anything that might lighten even a mental health load? I don't know.
Yeah, it's a good question. We are searching for things all the time. We do have access to some counseling that we can bring inside to work with staff. And it's more of a coaching and helping them really see what they need to do for themselves to take care of themselves. And then we have an EAP program also. Every once in a while, we, feed them. And I think, any kind of notes of encouragement are always appreciated. So that's great.
I think notes are great. The staff, we've really been, with our leadership and our joint management team, really focusing on gratitude and notes of any kind, and anything that you send to me, I send out to all of them, and encourage, because it's rough.
Councilmember Stratton.
Lindia, thank you for all your hard work. I do have a question. I'm sure that you're aware, or staff is aware, that we've had a pop-up warming center established up on Garland and Madison. And I'm just curious, apparently they're going through the process to get all of their regulations, the requirements done to physically open that. But once they're open, does somebody from the Board of Health regularly check in? I know the businesses around that area are concerned about COVID, but how do we keep track that if there is a case that they're connecting the way that they should be to the regional health district? Does that make sense?
Yeah, it does. We're aware of several pop-up shelters, and I know that Kylie is coordinating a lot with the city and the other ones that are getting set up, and they're doing kind of rotations to help them with infection prevention. The Department of Health actually is also coming over here and helping do site visits and giving them guidance. So we've put them in touch also with different shelters such as Mission and Cannon and all of those. So the other way is that we get complaints. And so then we can follow up on those complaints if they're not following different type of measurements. The biggest thing I've been hearing is staff or clients not masking, and then their spacing in the areas are not wide enough, which I know they're trying to fit in as many people as they can, but at the same time, we need to make sure that they keep those distances going.
Yeah, I just saw pictures of the one being set up on Garland. And to me, it's not enough space. But then they put a little, that looks like they're putting those plastic barriers between the beds. But the beds are still pretty close. So
yeah,
I'll keep an eye and listen. I've been up there a few times just making sure that everybody's doing okay with the business side of it. But I'll keep you posted if we have any other problems.
That's great.
Okay, thanks.
Any other questions for Lindia? All right. Thank you, Lindia.
Yeah, thank you.
And we'll go to our health officer report. Dr. Velasquez, welcome.
Thank you. Good afternoon, everybody. So first of all, thank you for the opportunity to continue serving. It's been an incredible experience. And I have a couple of observations, and I want to touch on a couple of subjects because I think Lindia's report is so comprehensive, which at least very little talk about, but I think that's the point behind it. So first observation is we do have here an incredibly talented, professional, gifted staff that has been really dedicated to this community nonstop for many, 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 many months during the pandemic and before that. And I do think that, and I'm speaking now as a community member, that perhaps I did not have a good understanding of how much the staff here is doing every day. And I think one of the things that I've been trying to do for the last 4 weeks I've been here is share and highlight that whatever I can, because it's not about what I can do, it's about what we can do. And the we is a lot of people, and the team here has been working very hard for a very long time. And I've had this conversation with Amelia and Lindy, and we're all trying to help. One of my biggest concerns with them is how long can they keep this pace as people? Because human beings, we can only take so much. But I have to tell you, I'm incredibly impressed. You can't have a better team of people taking care of the community, the folks that are here. So that's number one. I think number two is we also have a lot of experts in this building. A large number of individuals with significant expertise in many of the areas that Lindia mentioned and a few other areas that we haven't touched upon today. So one of the other things that I'm trying to do is try to have that expertise shared with the community. So if you watch a few of the Facebook's meetings that we have with the press, we've had a number of members of the team actually talk a little bit about their specific areas of expertise because they bring so much to the table. So I wanted to share that with you because one of my goals is to try to communicate that more broadly if we can. Now, I've also had the opportunity to meet with lots of people, lots of organizations, institutions, over the last 4 weeks. I think the unfortunate part is all of this is virtual because of the guidance that we have. So it's hard to really be more present physically in the community when we're restricted basically to virtual environments. So I'm looking forward to the opportunity of being able to do that. So a couple of the things that I wanted to mention, just so we are all aware, is we're in the middle of flu season. And although good news is we have not had any serious illness related to the flu or hospitalizations, we have noticed that the vaccination rates in Washington State are lower than they were last year. which worries me a little bit because although all of the guidance that we have provided in terms of facial coverings, hand washing, sanitizing, social distancing work through the flu, well, the flu is still out there. And we do have vaccines that have been around for a long time, so we should take advantage of that. From the district's perspective, just put a little bit of context, because as it was alluded to, although COVID is front and center right now, our disease investigators and the teams here are following every communicable disease, not just that one. And COVID came at the tail end of a hepatitis A outbreak. And right before, we had probably one of the most significant increases in syphilis and other sexually transmitted diseases at the tail of 2019 into 2020. And all of those are being managed, and hepatitis A outbreak has been basically somewhat controlled. So I wanted to highlight that because it's not just COVID that these teams are dealing with. They're dealing with a very large number of not only communicable diseases, but other things. So the second thing that I wanted to highlight a little bit is business technical advisors, which is a term that perhaps most people out there are not familiar with. And as Linda mentioned, these folks to date from the end of May have performed about 3,513 consultations, which basically means we've been in direct contact with institutions, companies, organizations, education, everything from events to religious services. As an example, this is the team that has helped with things such as the carriage rides that are coming up in the park, which is a Spokane tradition. The same team that has been helping restaurants with the open concept and the igloos, as well as schools, as well as many of the other efforts, including the symphony virtual gala that happened a couple of weeks. So I wanted to highlight that because this team approaches every request for guidance or information with the same attitude, which is we're not focusing on what we cannot do. Our focus is on what we can do and how can we help accomplish that. And I think it's something that I have seen. I participated in dozens of this by now, and the approach has always been, maybe we are not allowed to do the following because of the guidelines, but can we translate that into something that is achievable? And that is how a lot of these events, a lot of these items that I described are happening because of that approach. And I think that's important because what is it that we can do, and how can you help you accomplish that is what we're focused on. So I wanted to highlight that team among some of the other teams here. And then lastly, Linda alluded to what I call deployable testing. And deployable testing is testing that you can do not inside a big reference laboratory, but you can do it in the community. You can take it somewhere. You can send it somewhere. And we're deriving full benefit of that. For the last couple of weeks, we have very selectively used antigen testing in some of our shelters. And the rationale behind that is it gives us an immediate access to a result that allows us to have a disposition within 15 minutes. What does that mean? We've done about 365, 340. We've had about 40 plus positive cases, which we have been able to immediately provide for either isolation, quarantine, or whatever guidance is needed. And each one of those, if you think about it, can expose 7 to 10 people. So technically, we could have had another 400 cases or more, because each person can contaminate another 7 to 10. So we have deployed that as a proactive move. We're probably going to use more of that. And not only that, we're following very closely other types of deployable testing that will be coming in the future, such as saliva, and we're also following very actively not only the literature, but the practice on antibody testing. As we look at immunity and vaccine distributions, antibody testing will become important. So I wanted to highlight that. because I know we talk a lot about the PCR test, which is still kind of like the gold standard for diagnostics, but there's a lot of other testing that we're following that could be used in the community in a variety of ways. And we've had teams out there in the shelters pretty much every day doing selective testing and approaching that for high-risk populations. So I wanted to share that because I think one of my suggestions to the team here is we focus so much on getting things done that sometimes we don't share as much of what we're doing. And a lot of what we're doing is not only important, but it also will provide an example that can be followed not only by the health district, but perhaps by other entities and organizations. As you know, like the NCAA is looking at antigen testing too. So these are things that are useful for all of us in the community. So I wanted to highlight a couple of those things, just as we don't talk about those as much as we talk about COVID, and just wanted to thank you for the opportunity and really publicly thank the team here. They do deserve the community support and the community's appreciation. They've earned it. So that's the end of my report. I'll be happy to take any questions anyone might have. Thank you.
Any questions today? Dr. Kenley.
Dr. Velasquez, thank you for that update. I have a question regarding some of the antibody testing. The literature has been mixed as to what the long-term results will mean if you have positive antibody tests. Have you seen any updated literature suggesting that if you have positive antibodies, what the duration of that effect might be?
That's a wonderful question. As you pointed out, the literature is abundant and somewhat inconclusive. Actually, there's an article that was just published yesterday that demonstrates the measurement of neutralizing antibodies, strong neutralizing antibodies, all the way up to 6 months beyond infection, which is a lot longer than we heard before. I think before we were 3 to 4 months. Now we're up to 6. We don't know what that means. We do know that in animal models, there seems to be some immunity that can be conferred for a long period of time, but we don't know what that long period of time is, which I think is very important. I want to take this opportunity to say something else unrelated to antibodies. But as we look at the vaccine is another very important tool in the fight against this pandemic. But because not all of us are going to be vaccinated immediately, and even if many of us get vaccinated, vaccines are not 100% effective. We do know that. So some people will still get sick. The good news is if you get vaccinated, and typically if you do get the disease that you are vaccinated against, tends to mitigate some of the side effects. But what that basically means is that a lot of the practices that we have gotten in the habit to, like hand washing and hygiene and this, we probably need to continue doing some of that until we have learned enough about this virus to make a determination about long-term immunity. Because if you think about it, it takes us usually a couple of years to really understand how the immunology of virus is going to work. Long answer, but I want to take the opportunity to add the other piece there.
Thank you.
You're most welcome.
Any other questions today?
I just want to say thank you, Dr. Velasquez, for letting us know and having your insight into the staff, since you're, 4 weeks into your role, that it's very much appreciated, for you to share that with us. So thank you.
Thank you. I think it's important that we as a community know that, because as I said, the folks here very diligently do everything every day, but it's been tough. For them, and it's been very long, and I think that's true of all healthcare workers, and we do recognize healthcare workers, but these folks are part of that healthcare response, and because they do it from a public health perspective as opposed to a provision of care, perhaps we haven't been as aware of it.
Good point, and appreciate that insight, and welcome to the Spokane Regional Health District team.
Thank you, sir.
That will move to the financial report.
Thank you. So you have in your packet today, our financials, and we're on target. We're currently at 83%, and that's just through the end of October. So we know that through the end of this month, we will be wrapping up the 2020 budget on target. You also received in your packet the COVID budget report, finance report. And through November 16th, we have spent just over $6 million, but we are confident that we will spend all $8 million of the CARES funding that has been set aside for us from the county commissioners. So we are working through that. We've got a lot of supplies. We've had a lot of testing kits and different things come in. So I know that we'll hit that 8 million mark. One thing I did want to share with the board, just as kind of a heads up for a further discussion in January, but I think that we are all definitely feeling the concerns related to the fiscal cliff associated with the CARES funding and COVID. Lindia mentioned this a little bit. I have provided WSALFO, which is the Washington State Association of Local Public Health Officials, with our projections for if we stay at this current rate with our surge, the kind of funding that we're going to need beginning in 2021 to keep this up. And I will be bringing to the board a recommendation of maybe using our emergency funds that we have set aside. I still have your approval to use the $500,000 in emergency funds should we need to. But I think that if we don't hear from the feds or from the state by our January meeting, we may need to consider tapping into some of those emergency funds. So looking at kind of a best case scenario, worst case scenario situation is that best case scenario is that we need $11 million, and our worst case scenario is that we need $14 million. So that just to kind of fill you in on where it's headed. And the resources, similar to what Dr. Velazquez and Lindia have touched on, is that really when I look at resources beyond funding, right, beyond the dollars, is that I think that the staffing, both here at the health district and even within the health community, the hospitals, clinics, that continues to be a concern. And I know that in our conversations with hospital staff and hospital leadership, they're concerned about that as well, because there's only so many public health and health workers to go around. So just want to make sure you're all in the loop on that and know that I'll be probably bringing that back in January, because we still haven't received anything from the state related to CARES funding. And that concludes my my report.
Any questions on the financial report? So with the funding that you've identified already, because we did get some state money for 21 for COVID response, right? How long do you think that would last, or is that more you need to?
Yeah, no, I've projected that. We have 2.8 million that we can use beginning December 31st. Based on our current expenditures and the need for increased contact tracing, I think that could get us through the end of February. If we do need to set up an additional isolation and quarantine site, I think we would be looking probably mid-February as running out of those funds. We know that there is, some ongoing conversations, at the state level and, at the federal level, but I think at the local level, there hasn't been like an action per se, so we don't know how to plan for all this.
Okay, well, that helped give me a better picture. So thank you. Any other questions from the financial?
Ben, just real quick. I think a couple things, a couple points that were touched upon by Councilmember Wilkerson and Dr. Velasquez is that in addition to the COVID funding and our COVID response, we do have other needs within the community. Neighborhood Matters, our STDs, our hepatitis, things like that. And so one of the things that I'm looking forward to bringing forward to the board is the discussion that we need to have, and we've talked about having it for quite a while, is looking at the potential for local jurisdictional funding directly to the health district. And so my plan is in January, I've made representations about this, I know, but I have completed an analysis of where our funding sources for the health district come from, what that looks like, what the county contributes, what the state contributes, and potentially a mechanism for what we as local officials need to look at as what, if we have programs or priorities that we feel need to be maintained, a model for what we could look at contributing locally. It's going to be a hard discussion. There's not a lot of money, and I think that's one of the things that as elected sitting here, we need to be prepared for coming up in 2021, because we're going to have to not only prioritize our COVID response, because I know the county is running up on their deadline for being able to apportion out or have used up a lot of their COVID funding that they received directly from the feds. So the pot just keeps getting smaller and smaller, and we're going to have to look at what we as a region want to contribute for funding and what's important for us. To Amelia, to the first 3 contracts that we just approved here, or the first 2 contracts at a minimum. One of the things that we undertook as a board this year was to initiate implement the compensation study. And we all very well see here that we are in competition as a public health agency with other health agencies for high quality candidates. And without us moving forward on that comp study, we run the risk of not being able to have quality professionals in the health district. So we need to stay competitive to be able to attract those people, but that costs money. And we need to be prepared for dealing with all of those ramifications. So I look forward to us as electeds being willing and able to have these conversations and hopefully come to some sort of resolution in 2021 as to how or what we as a board and what we as a region want to our funding model to look like for this health district as we go forward. So thank you very much, and we'll all have fun in 2021.
All right. Thank you, Mayor Freeman. And we'll move to legislative. I don't know that we have any legislative update, but Amelia, no? Okay.
No, I think it was just the resolution. Yeah.
Okay. We'll move to board member check-in. And just out of no particular order other than how I see you on my screen, how about we, nothing for Mayor Freeman. All right. How about Mayor or Commissioner Cooney? Do you have anything for check-in?
Well, I'm just going to say, Ben, thank you for being a great chair this year. It's been, a long year. I know with COVID, as we've changed chairs in many different groups that we're part of, it was not something that any of us anticipated. And so you did great with all the Zoom meetings and putting them together and keeping everybody on track. And so I just want to say thank you for being such a great chair this year and doing such a great job with all the adversity going on. So thank you.
Thank you. It's been my pleasure. And it has definitely thrown for some curves this year in unexpected times, but I have a great group here and a great team at the health district. So with all the support from Amelia and Ann and everybody at the health district, it's made it a lot easier. So thank you. Councilmember Thompson.
Yes, I just wanted to point out that I wanted to just shout out to Margaret Shield, who was with the King County Health District, who started the 10 years ago the Medicine Take Back Coalition. And we worked on this for over 10 years with many, many people across the state. And so having the Medicine Take Back that our health district is going to be involved with just shows that community voices really matter and that we can move things forward. So I wanted to say thanks for that. And it's something that's come to fruition. And then I would just like to share my gratitude for the staff, for Amelia, for Dr. Velazquez. I mean, everyone who is working to keep our community healthy, and just urge everyone to really do their best to wear their mask, wash your hands, distance, just protect one another as best we can, because we as a community are bigger than this COVID if we can come together. So appreciate it. And then I had on my list to thank you, Ben. Appreciate it, and looking forward to having Mary take the helm and take us into 2021. So thank you.
Thanks, Councilmember Thompson. Commissioner Kearns.
Yeah, I'll just echo what's been said. Thank you to all the staff down there. Thank you also to each and every one of you that sits on this board. It's definitely a time commitment, and we're. I just want to thank you for everything you do, and Ben, especially you for 2020 chairing the board. I know it's an enhanced amount of work that a chair takes on. So thank you for your hard work. But again, just want to repeat, thank you to all the staff at the Spokane Regional Health District, and thank you to every one of the board members that have been on these calls.
Thank you, Commissioner. Dr. Kinley.
I just want to say thanks for, this has been kind of an interesting year to start out, first time being on the board. We go from, I barely met anybody, and then we went virtual for the last 9 months. So I appreciate being here and the opportunity to serve, and I enjoy working here with everybody and just asking questions from a slightly different perspective, because that's what I do and that's what I see. A lot of what the Regional Health District is dealing with is both community members and hospital. And so a lot of the questions that I ask are trying to, how do we navigate systems potentially prior to the hospital? Because that's the type of medicine that I practice, and those are the types of patients that I see. And so I'm hoping that it's helpful to ask some of the questions and be engaged. And I found the process very helpful and useful. And again, thank you to all of you for doing what you do, because you have a lot of knowledge in a lot of these areas that I'm not as familiar with on the business end, and all the different areas of working with the community, from city council members, the mayors, et cetera. So thank you.
Thank you, sir. Councilmember Stratton.
I just want to echo it. Thank you to everybody for surviving this year. It feels like we've become a stronger family because of it. And I appreciate everybody's efforts. And Ben, thank you for your leadership. And I am just hoping that the Twilight Zone ends soon. But I know we'll be ready if we have to stick this out a little bit longer. But thank you all.
Well, I miss your jokes too in the in-person meeting. So
I will have some new jokes.
okay, good. Look forward to that. Council President Biggs.
Yeah, just want to echo, but I think it is worth repeating. I really appreciate your leadership, and I'm probably more grateful than anyone, since I had the job right before you, and I could have served another year, and that would have really been challenging. So really appreciate it. It's really been challenging, and you kept such a level head through so many challenges. And I do want to, again, just repeat and acknowledge all the staff, from the most junior to the most senior. It's all necessary, and it must be somewhat frustrating. So few of us on the board, including myself, really have any subject matter expertise, and somehow we're in charge. And so many people in the public don't understand the commitment and the science, and people just, it's a little bit thankless. Often thankless, and people work so hard. So I just, again, want to pile on and thank you or say thank you.
Breen, I think I might have lost you there. Well, I don't know if you can still hear us, Brian, or not. All right. Well, appreciate everything, Brian, and Council President Beggs, and all that you did too. And you had a perfect timing award, I think, is what you get for being chair for last year versus this year. All right, Council Member Wilkerson.
Thank you. I have to echo Dr. Kinley, coming on this board this year. We were kind of the newbies together. I have to say it's been challenging but exciting at the same time, not only for all the staff who've done the work, but for the board, but really for the level of community engagement that has happened this year based on some of the challenges that we have had. So if people didn't know who the health board was before, they do now, and the work that we do, and I think there is a greater appreciation. So going forward, I look forward to Kevin's spreadsheet on financial matters and just the whole outreach, but really just the engagement at this level that we could come together, work through it, and then continue to put the best interests of our community in the health board. And I wish all of you happy holidays. See you in 2021.
Absolutely, and thank you everybody for being here with us as we took this journey or roller coaster of 2020. I think is more of a more accurate term, but it was how we pulled together that we were able to get through this and celebrate our Hollywood squares each month as we had our board meetings. And would be remiss to say as we brought in a new administrative officer, right, with Amelia coming in just a few months before the pandemic hit, and able to keep her through this and go through and become even stronger for our community. So thank you, everybody. And also congratulations to our Congresswoman, Kathy McMorris Rogers, and her new leadership role at the federal government, as well as the lead Republican in a major committee. So, all that. All right. Well, our next Board of Health meeting will be January 28th, 2021. And happy holidays or Merry Christmas to everybody. And hope if I don't see you before then. Do we have a motion to adjourn?
This is Linda. I move to adjourn.
Second.
All those in favor, please signify by saying aye.
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 All those opposed, nay. We are adjourned. Thank you, everybody.
Merry Christmas. Happy New Year.
Happy New Year.